Hi, Kavita. Thanks for joining us.
So happy to be here.
So, Kavita, could you just tell us a little bit about what your role is at Queen Mary and why students might get in contact with you?
So my role is sexual assault and harassment advisor. It's a bit of a mouthful. We go by Sahas. And my role is basically to support anybody at Queen Mary who's experienced sexual violence of any form. And that is a spectrum of behaviours. So that ranges from people who've experienced childhood sexual abuse, rape or sexual assault, as well as what might be considered lower level behaviours that are more like sexual harassment. My support with students is quite broad and quite holistic. So it's very much structured around what students want. So I will normally meet with the student for an assessment, get some information about the situation, and also get some information about what that person is looking for, whether that might be I'm struggling to focus on my studies as a result of this thing that happened to me. It could be I want to think about reporting this thing to the police or to the university. I don't feel safe in this current situation. I need help exploring my options to get out of it. And it's other things too. Everyone is really different and has different life and different priorities. And my role is to explore that with the student and figure out what the best course of action is, putting them in touch with specialist services. So it might be like counselling, external to Queen Mary. It might be that we are liaising with student support services to make accommodations, to get extensions, writing supporting letters for things like housing sometimes. Very much led by what the student wants, and very much operating from principles of being really trauma informed, helping them understand what happened, doing a little bit of psychoeducational work, so thinking about how they might be impacted by a traumatic incident such as this, which isn't something that most of us experience or know of what it feels like to experience, and can be quite a shock to the system because there are responses that we have that are very biologically normal, but we don't know that. And that can be really destabilizing and really difficult to process. So kind of normalizing some of those responses and being making people aware that it's okay, that they're not functioning very well in the aftermath of something like this. And my support is kind of long term. It's as long as people want to, it's as frequent as people want to see me. Try to be really empowering for the people that I work with. So making sure that students feel like they are able to make informed choices about what they want, so they know what's available to them, and then they can choose whether they want to go external for some specific support, whether they actually don't feel ready for that right now, and giving them information about a process so they can go in with their eyes open, whether that be reporting to the police or internal reporting processes as well.
Yeah, great. Thanks. And I'm aware of how well you supported several of our students from the Institute on different harassment and assault cases, right? So thank you. And so what can students do if they experience sexual harassment? What in the short and longer term?
Yeah, I think in the immediacy, it can be really difficult to identify what's happened. Particularly women, we are socialized to accept certain behaviors as normal. They're not normal, but we haven't quite got to a point where everyone has accepted that. What I would say is if you're feeling uncomfortable, listen to your gut. If you need to step away from an environment where that's happening and you feel safe to do so, we would strongly support you to do that. I know in particular some of the situations we've been talking about have been on clinical placement when it comes to patients and members of the public. We would, and I think that the Institute would strongly hope and push for students to feel confident to remove themselves from that situation and step away. Not everyone feels able to do this, but if you do feel able to verbally name the behavior and interrupt it, absolutely do that, but also recognizing how safe someone might feel to do that it's not always the case that that's possible. And then following that, seek support for yourself first, talk to somebody that you trust, express how something has made you feel. It may not be that you have that realization in the immediate aftermath or during the incident. It may be that you feel a bit weird about something straight afterwards. It's very normal. Like I said, because of the way that we've been socialized, we do tend to downplay things in the instant, try and laugh them off, try and make a joke about it, the perpetrators of these types of behaviors will also do the same. They will try and minimize the severity of what they're doing or have done. So it may be that it's a day later, it might be a week later, it might be a month later that you're still thinking about this one thing that happened and not actually able to get past it. And it might be affecting how safe you feel. So whenever that realization comes, we would really encourage you to come and speak to someone about it. If you are reporting something that's happening in the immediate sort of environment that you're in, speak to a tutor, speak to one of the nursing staff, and explain that you feel uncomfortable continuing the appointment. And they will probably talk to you about reporting. Dentistry has a couple of different reporting mechanisms because of the way that things are structured, but you can submit a raising concerns form through that's set up for the institute. People within the trust may also wish to submit a DATIX form, and there's also reporting support as a QM sort of wide mechanism that you can use. Reporting is a really difficult thing for people. Like, people don't feel that's something that they want to do, and while we'd encourage you to do it, no one's going to force you to. It is helpful, particularly when we're talking about patients, to start picking up on patterns of behavior. It may be that we have a patient who's doing the same thing to multiple students, and if we don't know about it, then we can't put safeguards in place. And that doesn't necessarily mean that you don't get an opportunity to work with that patient again. It just might mean that we put some additional people in the room and make sure that you're being observed, so that it reduces the likelihood of something happening. Perpetrators who do these kinds of behaviors will test boundaries. And so this is where I say it's really important to listen to your gut, because your gut is going to tell you when someone's pushing your boundaries, and is often quite accurate on that front. And it's good for us to be aware of someone who might just be testing the limits, because they may not test the limits with you. They may choose to test the limits with somebody else, and push that person's limits a bit further. Sexual harassment, particularly in sort of clinical settings or in public settings, in workplace settings, is often about power dynamics. And it's the person that feels that they have the sort of power to be able to do that to somebody else. And these behaviors start really low level and then tend to escalate. So we want to know about things that don't feel that serious, because they can be a build up to more.
What if it might be helpful to sort of explore some of the experiences that we've had on that, actually, in terms of the sort of behaviors that patients have reported? Because I'm conscious, students, sorry, have reported. I'm conscious of, for example, being asked for social media, to follow on social media, jokes of a sexual nature,
comments about someone's appearance that might appear to be compliments but actually make you feel a bit icky. And I think icky is quite an accurate way of putting it. And again, this comes back to that gut feeling. Is, I think that we often laugh these behaviors off, but actually that person leaves you with a bit of a bad taste in your mouth, and you might have to see them again. And sometimes and I guess this is the value of speaking to someone about it, is because sometimes in the first instance it isn't explicitly clear that this person is a threat or a risk. But it's good to talk it through and actually identify what it was that person did that made you feel uncomfortable. Because, as you say, these behaviors are seemingly quite innocuous. And that is often how the boundaries are pushed, is, can I make a sexual joke, and will this person laugh, or will this person stare at me like I'm a weirdo? And actually that then means they're not going to get on board with a further escalation of if I was to make physical contact with them, if I was to approach them outside of this workplace setting. And then maybe we're friends, and then the boundary starts to get crossed. And similar with social media, is you then start intruding into someone's personal life, and that's quite problematic.
Yeah, so clear boundaries from the outset really is so that you know when that's something, because it's a professional relationship, isn't it, in the end, with a patient, and it's not about being friends. Yes, we need to be friendly in our manner, or supportive in our manner, but we are not seeking to be friends with our patients, right? Whether we're male or female, it's
and that principle, maybe not around you can be friends with your work colleagues, but sexual harassment does happen between work colleagues as well, and recognizing that you you're well within your rights to expect professionalism in that context as well. And just because you happen to spend a lot of time together in the workplace doesn't mean that you have to be friends and intimately involved in each other's lives in a workplace setting either.
Yeah, and it's the same for students, right? In terms of peers,
Absolutely.
and a lot of our students work in groups, clinical groups, for long periods of time, and absolutely, yeah. Thank you. And is there anything different or additional that a student might do if they're assaulted? And I appreciate assault can be a part of the harassment, but just to sort of separate it out for the purpose of this conversation.
Yeah, so sexual harassment is what I would call an umbrella term, and it covers everything from what we were discussing in terms of sort of sexual jokes, don't like calling them jokes, and inappropriate comments. But things like sexual assault and rape can be considered sexual harassment because they often follow a pattern of behavior. So if you experience a sexual assault or a rape, it's really important to highlight that that is a criminal offence and something that should be treated a lot more seriously, or there are more options for you to treat it seriously should you wish to go down that path. You can report it to the police. Things to consider in the immediate aftermath are, when we're talking about incidents where there's been penetration, there are forensic limitations in terms of evidence collection. So I believe it's 7 days is roughly the window within which they like to do a forensic examination in the aftermath of an incident. So that's one thing to think about, is you may not wish to report immediately, but if you think you might want to report and you might want to collect forensic evidence, then that is something that should be prioritized if you even want the option of doing that. Just because you go through the forensic exam does not mean that you have to report to the police. That evidence can be stored and kept until you feel ready. Sometimes what can happen, so the organisation that does forensic medical examinations across London is called the Havens. We have 3 sites, one in Camberwell, one at Royal London, one at Royal London and one at Paddington. There's a central helpline that you can call. It's a 24/7 number, but sometimes they're not supposed to, but sometimes they say you need to report to the police and then they can bring you in for a forensic exam in order to sort of rush it, because the police have priority and they'll say they don't have any appointments. In that case, you can do that, but I understand that that makes it a much more difficult decision to make. Again, this is a good situation where speaking to either myself or someone from a rape crisis service would be best placed to give you the sort of right advice on what your options are. But that's just something to flag to people, that sometimes while the services are not supposed to pressure people to report, it can kind of be an indirect pressure of, if you want a forensic medical examination, you need to go through the police. The other thing to bear in mind is if there might be any CCTV. So that's the other thing that's sort of time sensitive. So CCTV is typically kept for around 30 days, and then people will overwrite the existing CCTV as each day goes. The time frames on that are very vary. So you might have one that's 28 days and one that's every month. And so if you think that might be helpful, and you can get hold of CCTV evidence or request that it be saved, then that might be something else that you might want to do. Accessing CCTV can be tricky. It needs to be requested by the right person. It may be that they insist on a police request for the CCTV, but it's just another thing to factor into your decision making about whether you want to go through that path. You are not obliged to report to the police. You can also start the reporting process and then withdraw later if you wanted to, and that's a very reasonable and very okay thing to do. It does happen, and it's very understandable given how difficult that process can be for some people.
And I think, yes, and I from working with you and also from that conversation it is clearly very complex, isn't it? And the criminal justice system in itself can be quite a traumatic process in itself, and therefore that's the importance, I think, of you and your role in that. Coming to you does not mean a student is suddenly on this process to reporting and police and whatever. It's really about exploring what support is needed, whether reporting is appropriate for the patient, for the person there, right?
And it's I see my role as very much making sure that people feel empowered to make the choices that they want to make. When we don't know a lot of information, we then tend to make decisions and then go, oh, well, if I'd known X, then I probably wouldn't have done that, or I would have done that. And for situations like this, it is really important that the person who's experienced what is a really disempowering experience is able to reclaim some of that power and control over the decisions being made about their life, and able to make those decisions for themselves. And even, if I sit down with somebody and I talk them through the reporting process and they go, I don't want anything to do with that, them knowing that actually I made a choice to not go through with it because it didn't work for me is empowering. It does give them a sense of control, because it then isn't a, oh, what if I had chosen to go down that path? It's no, I could see that wasn't what I needed right now. And that's a really important thing to sort of mental notes to have in your recovery process, to be okay with the decisions that you were able to make for yourself.